Hello everyone, my name is Paola Soriani and I am an endoscopist at Azienda USL Modena, Italy. I am the principal investigator of our study entitled Over the Scope Clip as a first-line treatment of peptic ulcer bleeding, a multicenter randomized controlled trial.
Hi, my name is Manno and I am the director of the endoscopy unit of Azienda USL Modena, Italy. The idea for our study came a few years ago from the clinical observation that standard endoscopic therapy of peptic ulcer bleeding, in particular using through the scope clips, sometimes is not enough, especially for large and fibrotic lesions in difficult locations. This is a particularly relevant clinical problem, since acute non-variceal upper GI bleeding is a common clinical presentation with up to 10% mortality rate.
Compared to standard therapies, the over-the-scope clip has shown promising results as a first-line treatment for acute non-variceal upper GI bleeding. Hence, we designed a head-to-head randomized controlled trial, specifically comparing two mechanical treatments, i.e. OTS clip versus TTS clips, as first-line mechanical treatment focusing only on peptic ulcer bleeding.
Hello, my name is Giuliano Bonura and I am an endoscopist at Azienda USL Modena in Italy. Our study was conducted at 5 European centers, 4 in Italy and 1 in Spain, and we randomized the 61 and 51 patients with Forest 1A to 2B peptic ulcers to OTS clip and TTS clip treatment respectively. The rates of 30-day rebleeding were low in both treatment arms, and OTS clip was not superior to TTS clip regarding 30-day rebleeding prevention. However, we observed that OTS clip has a higher efficacy than TTS clips in achieving successful initial and durable hemostasis, especially in fibrotic or posterior duodenal bulb wall peptic ulcers.
Hi everyone, my name is Paolo Biancheri and I am an endoscopist at Azienda USL Modena in Italy. While our results would suggest a routine use of OTS clips as a primary hemostatic method for bleeding peptic ulcers, this should be carefully balanced against the consideration of cost-effectiveness. Nevertheless, the evidence that OTS clip might be more effective than TTS clip as first-line treatment of certain difficult peptic ulcers is important to inform clinical decisions and avoid unsuccessful hemostasis with subsequent need for retreatment or angiographic therapy and prolonged hospital stay.
Our project was supported by Azienda USL Modena Research Funds and was awarded with the 2019 ESG Research Grant. This achievement gave our team extra motivation to conduct the clinical trial. Moreover, last year the study was selected as one of the best for abstract in the 2023 ESG Days, and we were deeply honored to present our findings in the plenary session of last year's European Conference. Finally, it feels wonderful to be able to close the circle by publishing our study on the prestigious Endoscopy Journal.
We want to thank all the colleagues from ours and the other endoscopy units who contributed to this study. And last but not least, we want to thank the European Society of Gastrointestinal Endoscopy for the continued educational opportunities and for their support during this amazing journey.